Welcome to Fast Physio Facts with me, Mick Hughes, episode number 5, and today I'm breaking down a 2025 clinical trial or randomized clinical trial by Ep5 and colleagues on whether or not yoga or strengthening is better when it comes to managing knee osteoarthritis. So we had 117 participants, all aged over the age of 40, who had symptomatic knee OA. At baseline, we had all participants reporting about 54 out of 100, or about 5.5 out of 10 pain. So the pain was considered moderate at baseline. We had 58 of them randomised to a yoga group and 59 randomised to a strengthening group. Average age was in about early 60s, and about 3/4 of them were women, and their BMI at baseline was in their high 20s. All had unilateral symptoms and were really a real-world appreciation and clinically relevant person that we'd see presenting with knee OA. The authors did exclude people who had been doing yoga or strengthening previously, or had previous knee injuries or surgeries in the recent months, or had knee replacement or recent injections. So they were looking at a pretty clean and tidy group of symptomatic OA participants, as they tend to do in research world, but nevertheless. Look, what did they do? So both groups got a comparable dose of exercise. So for the first 12 weeks, both groups did 2 supervised 1-hour sessions of exercise, plus 1 hour per exercise session at home. And then from weeks 13, so this is the first 12 weeks, so a lot of exercise. Then from weeks 13 to 24, they were encouraged to do 3 home sessions per week, unsupervised. Yoga sessions followed a very consistent structure. They looked at both settling and breathing techniques, and then movement sequences, then relaxation and meditation. The strengthening group was very physio standard, I guess, so to speak, and very nicely prescribed and progressed over time. Each supervised strengthening session was 60 minutes in total, which included your warm-up and your cool-down, and 45 minutes of progressive lower limb strengthening in a circuit. They used a tolerable pain framework where some discomfort was okay and expected early, but symptoms shouldn't have flared later on that day or later on that night, and there should be no increased pain or swelling the next day. In terms of dosage, week 1 was about learning and movements with lighter load, with 1 set being acceptable in these early stages, and it was progressed up to sets 2 and 3 over time. The strengthening exercises were roughly your classic, 3 sets of 10 programming with about a minute, 30 to 60 seconds rest between sets, and progressed across 4 levels over the 12 weeks. So a pretty good mix of exercises that classically included your sit to stands or squat progressions, including wall squats, step ups and touchdowns, with or without a small external load, seated knee extensions, single leg calf raises, hip work, balance, movement, control, coordination. The breakdown of the exercises are in the paper link. This is a free access paper too that you can read and digest yourself. So what were the main outcome measures? The main outcome measures was change in pain at 12 weeks. So basically at the end of the intervention, so from baseline to 12 weeks on a 0 to 1 out of 100 scale. They also tracked commonly used outcome measures in OA circles called the WOMAC scale, which looks at pain, function and stiffness. Plus they also looked at other performance tests like chair stands, a 40-metre fast walk and a stair climb test at the 24-week mark to see what the long-term results were as well. So what happened? At 12 weeks, the headline's pretty simple. Yoga and strengthening improved pain by a similar amount. Pain dropped by about 17 to 18 points, so nearly 2 out of 10 pain with yoga, and about the same in the strength group. So about a little bit less, with about 16 to 17 points in the strengthening group, but there was no meaningful difference between the groups. So I was at the 12-week mark. At the 24-week mark, so about 6 months post, and then 6 months post the start of the intervention, but 3 months after the trial had officially ended, pain still wasn't dramatically different between groups, but yoga started to show a slightly clear edge on the outcomes measured, and the ones that physios and patients care about. So pain, function, and stiffness tended to improve more with yoga by the end of the follow-up period. So that was interesting. Adherence across the two groups was really good. So about 70% of the prescribed sessions in the first 12 weeks was good across the board, but yoga started to look a bit better later on as well. So not a bad, I guess, clinically realistic look at interventions being done consistently, but also too looking at the right things over time. Look, I think this is one of those cases where we're probably seeing both interventions change positively. So pain initially over those 12 weeks, where there were no differences between the groups, but the function, quality of life and knee stiffness symptoms were probably just slightly ahead with the yoga group by the 6-month mark after the intervention had finished. So look, at the end of the day, strengthening is certainly an important part of the process, but it isn't the be-all and end-all, as we're probably seeing again, much like the shockwave therapy intervention that I talked about in one of my previous episodes here with the proximal hamstring group. It reduced pain similar to the graded exercise group. So exercise, it's good and it's important, but is it the thing that makes a huge overall difference? Well, probably not, because we're seeing changes in yoga. Something that the person will adhere to and comply with and do on a consistent basis. It seems to me that probably consistency in exercise and movement, as well as some patient education and some reassurance and some exercise. I guess advice and education on what to expect and what to feel is okay in terms of pain response and how you pull up from exercise sessions. Like, it's all part of us being great physios, and that education is super important. So yeah, like I think yoga is a great option, and it's clear that someone who's in their 60s who may not love the gym, may be threatened by a gym environment, but would happily go off to a group exercise class with their mates and do some yoga and do some stretching. I think that in itself is a huge win. So ultimately, this trial shows that we've got choice here to show to our patients. And now, if our patients love exercise, love going to the gym, then good. Encourage that. It'll help their knee OA symptoms. Conversely, if they don't love the gym, then we've got an exercise choice out for them that exists outside a gym environment. So, that's the trial. The full link to this paper is available underneath this video. So feel free to have a deeper dive and have a look at what exercises were done and how you could apply maybe some of these exercises and programs into your patients' weeks and months. Conversely, you could have a look at the yoga trial too and the yoga exercise and see how that sort of aligns with either your practice or a recommendation that you might give to your patients to go off and see another practitioner. So probably not the fastest physio facts, but one there that's hopefully will benefit you and your patients and help them get better outcomes. So until next time, thanks for watching.